welcome back. And I'm here with Tamara from the hospital. You're an RN from Sutter Amador Hospital. So good to meet you this morning.
Good to meet you, too.
And you're actually the new lead, the education coordinator. Is that what you were saying?
Well, I am the education coordinator, but because Sutter Amador is such a small place,
yeah.
I wear many hats.
Yes,
and
I hear you.
The reason I'm here today is to talk about stroke, because May is Stroke Awareness Month.
Okay.
And that's such an important issue. And I'm the stroke coordinator at Sutter Amador.
Okay.
In fact, we are a primary stroke center. We just had our recertification from the Joint Commission and passed. So we're really excited about that.
Excellent. Yeah, this is a hot topic. I mean, you know, we read online different news websites and things like that talking about strokes and how common they are. And I know we'll talk a little bit about they're becoming more common in women, too. And today you're going to talk about what the causes are.
Yes, I'm going to talk about, well, first of all, you need to know that stroke is the fourth leading cause of death. It used to be the third.
Yeah,
so hopefully that means that we're doing some good with talking about it a lot.
Good, okay.
But what I think that everyone also needs to know is that it's the major cause of disability. And so if any of you have had patients or family members who've had strokes, I'm sure you've seen that.
Yeah.
The good news is that rehabilitation is very good for stroke, and so we get a lot of people who come back to almost normal.
Yeah.
So, but there are really preventable causes of stroke, and that's a really important thing to think about, your risk factors. So number one, I think about my neurologist, Dr. Van Fossen, who talks about it. Don't smoke.
Yeah.
And so we know that in terms of all illnesses. And, you know, stroke is a vascular disease, just like heart disease. So much the same risk factors. Like.
So if you smoked, let's say you smoked for 25 years, but you quit, does that reduce your risk quitting?
Absolutely,
I mean, it doesn't. You're not going to pay the penalty for smoking for 25 years. When you quit, you're going to.
But it doesn't mean that also your vessels may not be normal anymore either.
Right. Okay.
So some of the other ones, and certainly high blood pressure, hypertension. So if you have high blood pressure and the doctor has ordered medication for you, please take it. It's a heartbreaker when I see patients who come in and they ran out of their meds and didn't refill them or didn't like how they made them feel, because we can try different medications.
Yeah.
But you need to take it. Hypertension can cause strokes.
Yeah.
Obesity, sedentary lifestyle, you know, just like what they talk about with preventing heart disease, is you want to move, you want to exercise.
Yeah.
Diabetes is a difficult disease. I think diabetes is sad because you don't always see symptoms, but it's really kind of working inside.
Yeah.
So diabetes also is a risk factor for stroke, and high cholesterol. And then atrial fibrillation, where the heart kind of makes a fluttery kind of beat, is another cause, and that can be managed with medication. But if it isn't managed, it also can be a cause of stroke.
Okay, so let's talk a little bit about that, because I have periodically in my life had that.
Okay.
And I actually went to the hospital about 5 years ago. I was at work, and it was like, it scared me. And I'm pretty tough, you know, but it scared me. It was like, this is not normal. I went to the hospital and checked out fine. But is it possible to have that periodically? Is that normal to once in a while get something like that, or should you get checked out?
Well, no, you should see a doctor. You talk to your doctor about it, because no, it's not normal, and we certainly don't want it to be sustained.
Yeah, absolutely. Well, sometimes you get a little stress, and your heart feels a little funny.
Well, you could have a little funny beat.
Yeah.
We had too much coffee.
Yeah, exactly.
Right,
yeah.
like
so
you said, the stress.
Yeah.
So, and there are two kinds of stroke. There's what we call ischemic stroke, which means that there's some lack of blood flow and oxygen to a part of our brain, or the hemorrhagic stroke, where there's a bleeding in the brain. So, more often, about 87% are the ischemic strokes, and those are the ones that we have a drug called the clot buster, just like they use for the heart, that can help with those. But time is you must get in as soon as possible. I think that just like with heart disease and heart attacks, we get into denial.
Yeah.
Oh, this funny feeling in my face, it's going to go away.
Yeah, exactly.
Oh, my arm doesn't work right. What's that?
Yeah.
And we don't do anything about it.
Yeah.
If we're going to use the clot buster, we need to get there within 3 hours, at the most 4.5 hours, get to the hospital, so that, because there are certain things we need to do. We need to get a CAT scan. People have heard about CAT scans, and that will show us, because we can't give the clot buster if you've had a bleeding in your brain, because it'll cause more bleeding.
Oh,
and
I
that's
see.
not good. So that's why you have to have the CAT scan.
Yeah.
And some lab work, and then we can give that clot buster. So we've had some good results with that at the hospital. And then the other thing, people sometimes talk about mini strokes or precursor to stroke, and that's a TIA or a transient ischemic attack. And that just means that maybe a vessel, for whatever reason, had a short period of time of a lack of oxygen to it. And you get some of the same symptoms. And so that's kind of what I think we want to talk about fast, which is kind of the way to remember what are symptoms. And so I actually have my stroke badge on. Whoops, no, I gave my stroke badge away when we had the surveyor here. So FAST stands for face. So if you have funny feelings in your face, a droop in your face, that's a problem. A stands for arms, or actually it means extremities. If you have some weakness, that would be a real problem. S stands for speech. So any garbled speech, inability to speak, that can be a sign of a stroke. And T stands for time, because a stroke is an emergency, just like a heart attack is an emergency. We absolutely have to do something about it, because we're losing brain tissue at that.
That's scary.
It is scary.
Yeah. So some of the things that so again, be aware of these things, live a healthy lifestyle.
Absolutely.
Nutrition, balance, and smoking. Does alcohol contribute?
Well, too much. Too much. Everything in moderation, as they say.
Yeah, absolutely.
Right? Yes.
Okay, that's a very important information, because, like you said, people do go into denial.
We do.
People don't want to face that there's a potential medical condition.
No.
But if you don't do that, then you're going to it's going to make it way worse. What percentage of people who have strokes recover? Do you know that statistic?
I don't think I can tell you exactly what that statistic is. I want to tell you that as a nurse, I've been a nurse for a very long time, and I've seen a lot of stroke patients. The thing in the hospital is that's sort of the acute phase, so we don't get to see the long-term rehab. But in my own family, my dad had a couple of pretty severe strokes, and he went through acute rehab and came back to almost normal.
Is it hereditary?
No, not exactly, but if you have bad vessel disease, it can be.
It can be, okay. Thank you so much for your very informative interview this morning.
Thank you.
I learned a lot. It's a very important subject, so we're going to head over now to Ted Novelli for a supervisor's update.